Thank you, Mr. Chairman. Mr. President, thank you for your incredible continuing service to this country and, for that fact, for the world, to what you're doing in the foundation. And Mr. Gates, thank you for making a difference in an individual using their resources to actually be willing to make a difference in a really powerful, positive way. You know, I'm fortunate enough to chair the subcommittee on all of our foreign assistance abroad, and I'd like to take your experiences a little bit, and certainly I'm with you foursquare on the global health initiatives, but to try to extend out some of those experiences on how we may do better. You know, Mr. President, you, as the United Nations Special Envoy to Haiti, you have a tremendous amount of convening power, as well as tremendous reach across multilateral efforts in Haiti. I know that work is only going to get harder, even though we've had a tremendous response, but it's only going to get harder in the days ahead. And it seems to me in some respects that Haiti is an example not just of a technical challenge, but a leadership challenge as well. And I'm wondering, as we look at Haiti, you know, and our responses there, are we doing enough, whether it be Haiti or overall long-term thinking about how we do foreign assistance, and how, in that context, are we looking at how we develop leadership at the end of the day within countries to help us, whether it be global health initiatives or development assistance or other efforts, because we can externally provide resources and make a difference. But at the end of the day, whether it be today's Haiti or tomorrow somewhere else, the question is how at the same time do we create indigenous leadership to move this in the right direction. And Mr. Gates, if you could comment on that as well as that you have a unique ability through the foundation to make long-term commitments and which individuals and countries can ultimately depend upon, and that's somewhat transformative versus what we do here in the Congress on annual basis. So I wonder, do you have any thoughts in that regard as well? I'd love to hear from both of you.
Well, first, I think it's very important. President Praval is here and is meeting with the President today. And the Secretary of State and I had dinner with him and his wife and his team last night. The Haitians have got to settle on one of a few options for a model for how this reconstruction process is going to play out. I believe the one that Indonesia adopted after the tsunami is a good model. It's something like that will give the world the confidence that there will be great transparency in the process, and that it will be moving in the right direction. Secondly, Haiti has, it's a bigger job proportionally than even Aceh was, but it's got some advantages. You've got a real commitment there on the part of the Haitian government to the modernization process. And again, I think that our goal should be empowerment. You know, and in that sense, our model should probably be Rwanda. The Rwandan government hopes to receive no foreign assistance by 2020. And to give you an idea, this is one thing I think you can tell our constituents, by the way, about whether it works. In 1998, 4 years after the Rwandan genocide, the per capita income was still only $268 a year, less than $1 a day. 10 years later, $1,150 a year. There is no other country in the world that quadrupled its per capita income, even from a low base, which shows that this can be done. And and I would say to you that the Haitians had adopted before the earthquake a very ambitious long-term development plan to genuinely modernize the country and make it more self-sufficient. It covered education, it covered economic development, it covered health, it covered the whole range of issues. Required them to modernize their government and open it up and open the port system and the airport system and all this. Their plan. They're sticking with the plan and putting the response to the quake into that plan to amend it as soon as the post-disaster needs assessment is completed. So I believe that we got a real shot to support a successful enterprise there, Senator, because they think the same thing you do. They think they have to retain talent. They have to be held accountable. They want to not need us except as friends, and that's what we're trying to do. The key is in the structure and the personnel, but I believe, based on the conversations we've had, they're going to make good decisions on that.
And there's always the challenge of which countries to help, the ones that are in the greatest need or the ones that have the best government, so that the money will be most effective. And right now in Ethiopia, certainly in the health area, they have very effective leadership. And the GHI proposal talks about some of the ambitious goals they've set for Ethiopia. You know, the government's decided to do health workers, and so the U.S. money will allow them to succeed with that program. There are some things like vaccinations that can be done even in the worst areas. The vaccination rates in Somalia are higher than in many other countries. So if you get in, do grassroots work, vaccination can work. Some other things, like getting a mother to a clinic to treat conditions that might come up, that's very difficult if you don't have reasonable governance, reasonable roads. And so these programs have to be tailored. Vaccination should be done everywhere. Some of the other things, like really training healthcare workers and trying to get a big improvement there, you want to pick places where you have strong governance. And GHI has this idea of picking countries. You know, they have a challenge with India in particular, where you don't want to pick the whole country. You probably want the ability to pick parts of the country. It's just too important to the global health picture not to have it be involved in some ways. Likewise, Nigeria is a challenge. You know, the health statistics are tough there, and so you want to work, and yet the government coordination hasn't been very good. And so, you know, you've got constant trade-offs. We've got, from our foundation's point of view, we've got to be in Nigeria. That polio, that's the last place in Africa it still is, and we see some improvement from what was being done in the past with the debt relief dollars, a bit better governance.
Senator, could I just go back? One thing you said relates to what Senator Lugar asked me about the impact of this on foreign assistance, on our foreign policy. Before the current coalition government took office in Zimbabwe, we were providing pediatric AIDS medicine and some other antiretrovirals, because under the UNITAID agreement, we got 2/3 of all the kids in the world that get this medicine get it from the contracts we negotiated. They didn't have any other way to get it. Now, we cleared it, but the State Department made the right decision. They said, even though we're at odds with Mugabe and there's all these controversies, first, there's a humanitarian case to be made, and second, South Africa is wallowing in an AIDS problem that in part has been aggravated by people pouring across the border from Zimbabwe. So I think that that goes back to what Bill said. I think there's an inherent conflict sometimes between how good the government is and how much the need is, and there is no one rule, but you can't walk away from the humanitarian crisis, and often turns out that's the best policy.